I'm Dr. Barbara Burton. I'm a clinical and biochemical geneticist at Northwestern University and the Ann and Robert H. Lurie Children's Hospital in Chicago. I had the pleasure today of presenting some data from the MARS registry, which is a registry of patients who have MPS IV or Morquio-A syndrome. And in addition to the registry data, this was combined with some data from an earlier natural history study called MORCAP, and the goal was really to look at the impact of enzyme replacement therapy at different ages, because there has been some concern that maybe at a certain age ERT may not be beneficial for patients, whereas when they're younger perhaps it would be. So what we did was we looked at a comparison of treated and untreated patients at various different age intervals, starting with very young patients, and then the oldest age group we studied was patients ages 20 to 30. And compared 6-minute walk test distance in patients who were untreated, had never been exposed to enzyme replacement therapy, versus those who had a history of treatment for at least 6 months, and in most cases patients had been treated for 4 or 5 years or sometimes longer. And what we found was that regardless of the age group, there was a very clear benefit of enzyme replacement therapy with an increase in the 6-minute walk test distance. This was a particular endpoint that was chosen because this was the primary endpoint in the original clinical trials of Vimizim, and it reflects the mobility of the patients and endurance, and is really impacted by multiple factors. In addition to showing that patients benefit from enzyme replacement therapy at all ages, we also saw that the impact was really quite robust in some of the age groups, with an increase in 6-minute walk test distance of 40 plus meters and some more than 60 meters. So really these were not trivial changes, but ones that are certainly clinically very significant. So I think for us it answers the question of, is there an age at which a patient is too old to benefit from therapy? And the answer is at least up to the age of 30, which was the oldest group we had enough patients to study. There seems to be a very clear benefit regardless of age. I think the take-home message is exactly that regardless of the age of the patient, they are likely to see a significant benefit from treatment with enzyme replacement therapy for Morquio-A. I think as compared with some of our other lysosomal diseases where we have enzyme replacement therapy, there's been a little bit more skepticism here with Morquio-A because it is primarily a skeletal disease, and of course after a certain age you're not going to have a significant benefit on the patient's height or on skeletal manifestations, but yet it is a multisystemic disorder and there are benefits in other domains, and these are reflected by increased endurance and mobility. So even for patients who are 25, 30 years of age, perhaps they use a wheelchair much of the time, as many of our patients do because of long distances. While they're still able to walk around the home, they may use a wheelchair at other times. Those patients still can very much benefit from treatment with enzyme replacement therapy.